The interim analysis of the EMIIL study showed very nice results. It's a study with Emicizumab, prospective, multicenter, non-interventional study with a total observation time of 5 years, a recruitment time of 4 years. So the observation time for the patients is about 1 to 4 years. And it's a real-world study that should reflect on the real-world use of Emicizumab in patients with hemophilia A without inhibitors and with inhibitors. On this meeting, I will present only the data on those patients without inhibitors, because this consists of the main recruitment. There were a total of 85 patients, mainly severe or exclusively severe hemophilia A, as by definition of the inclusion criteria, a median age of 26, and the primary outcome parameter was ABR, and the interim analysis with the data cut in the middle of last year showed a reduction of the ABR from a little more than 4 to a calculated mean of 1. And if the modeled calculation was used, it was about 0.63. The bleeding was different in the age groups. It was lower in those below the age of 12, and it was higher in those above the age of 12. And in overall, it was a very successful study with very, very good outcome with respect to bleeding episodes. There were no safety signals in the study, no unexpected safety signals. There were very few safety reports related to the product, but also these were not of concern. So overall, a very successful study. No deaths, no thromboembolic events. There were no inhibitors towards Emicizumab. So an overall very, very successful study. The majority of patients that were included were either below 12 or within the age of 18 to 65. There were very few adolescents and very few elderly patients. And if those patients were further looked how many bleeds they had, and they were subcategorized in 0 bleeds or 1 to 3 bleeds in 12-week observation periods, then the number of bleeds and the number of patients that had 1 to 3 bleeds within these observation periods of 12 weeks, they were between 10 and 20% of the whole observation period. So overall, very, very good outcome of the study as a real-world experience from the centers in Germany and Switzerland.